Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing one of my favorite topics in physical therapy, and that is strengthening of the deep neck flexor muscle group. And understand going forward, the deep neck flexors go by a variety of names. Sometimes you'll hear them called the craniocervical flexors. They're the deep cervical flexors, cervical retractors, and I sometimes float between deep neck flexors and cervical retractors, but they all refer to the same four muscles on the left and four muscles on the right. Now, before we get into the specific exercises for strengthening this group, I think it's important to understand why you would want to strengthen them. And I think it's important both from a clinical standpoint, and for that we'll look at some of these journal articles briefly in just a minute, and then number two, from an athletic standpoint. So from an athletic standpoint, getting these muscles strong is very important, particularly in contact sports, really all sports, but especially contact sports like boxing, mixed martial arts, football, rugby, etc. If you don't have a strong foundation for your neck is not as strong as it could be, and it's not as resilient against injury as it could be. And these muscles are the foundation of a stable, strong neck. It's kind of like a house. I don't care how many giant stones you put around it or how many steel beams you got supporting the walls and the roof. If your foundation is not sound, it may not be today, it may not be tomorrow, but that house is not going to last as long as it needs to. So we need to get the foundational muscles as strong as possible so that way we can pack a lot of strength around the other muscles, the gross muscles of the neck that facilitate gross movements like flexion, extension, side bending, and rotation. Okay? So from an athletic standpoint, you need these muscles strong to maximize strength, stability, and reduce risk of injury. Now, from a clinical standpoint, they have pretty extensively looked at this muscle group and the effects that it has on people with neck pain. And so we're going to very quickly summarize about 4 papers here and get the big takeaways from these. And this is justifying why you would want to strengthen this muscle group in a clinical setting. So the first paper here is Clinical Effects of Deep Cervical Flexor Muscle Activation in Patients with Chronic Neck Pain. And if we fast forward through the abstract to the results and conclusion, in the deep cervical flexor group, the NDI, NRS score, and the neck-shoulder postures, which were analyzed in a variety of ways, were significantly improved. Okay, so the NDI is a disability measure. So disability was reduced, which is good. The NRS score is pain level. That was reduced, which is good. And then posture is improved. And you'll see this in another paper referred to as craniocervical posture. But just generally speaking, it improves disability, pain, and posture. And so again, they obviously recommend that this approach should be used in the rehab of patients with chronic neck pain. Let's go to the next one. Effects of specific deep cervical muscle exercises on functional disability, pain intensity, craniovertebral angle, and neck muscle strength in chronic mechanical neck pain. This is a randomized controlled trial. Fast forwarding to the conclusion, the results of this suggest that 6 weeks of training in both exercise groups can improve neck disability, pain intensity. This is the craniovertebral angle, which is a measure of posture, and then also neck muscle strength in chronic mechanical neck pain. So really just corroborating what they found in the previous paper. Now, one thing interesting about this one is not only do they have a control group and a deep neck flexor group, they also had a cervical extensor group. And by cervical extensor, we're not talking about protraction. We're talking about straight, gross extension, okay? And so they also found that extension produced significant effects in these parameters: disability, pain, posture, etc. So long story short, this shows that deep neck flexor muscle training should be included in the plan of individuals with chronic mechanical neck pain. But it also shows that cervical extension training can also be effective. And we cover cervical extension in a later video. And I think that's important to know because cervical extension also tends to be a neck movement that I think is underdosed by the vast majority of physical therapists out there. They maybe go to this isometric one and then that's about it. They don't do much else beyond that. But there's so many more exercises that you can do for cervical extension. We'll wait a few videos to cover that, so make sure to check that out. It'll be on my channel by the time I upload this video. So here's the third paper. Comparison of 3 different exercise trainings in patients with chronic neck pain, another randomized control study. Now, in this paper, they did it a little bit differently. So yes, they had a control group, which was just traditional, conventional treatment. They had a second group that got that in addition to deep neck flexor training as a very specific focus, and then a third group that was the traditional training plus core stabilization exercises. So we have control, deep neck flexor training, and core stability training. And you might be thinking, well, why would core stability training have any effect on chronic mechanical neck pain? But let's see what they found. If you apply core stabilization exercises, not and or deep cervical flexor muscle training to patients with neck pain, it's going to be effective at reducing pain, improving posture, improving range of motion, and also reducing disability. Okay? So, what they found, core stabilization exercises can be as effective as deep neck flexor training for treating chronic neck pain. And if you want more information on core stabilization exercises and core strengthening, you should go check out my videos on my channel that are already uploaded by the time I'm getting to this video. Now, personally, I would have liked to have seen a fourth group here, or maybe a follow-up study, where they take, again, people with chronic mechanical neck pain and do both core stabilization and deep cervical flexion in the same group. Do those people get even greater effects in these parameters in the same time period, or maybe in the same time period they get to those points a little bit faster? Again, we don't know, but what we do know is core stabilization exercises, surprisingly, are actually pretty effective for treating chronic neck pain. And then that leads us to the systematic review here, one of our highest levels of evidence. Effects of deep cervical flexor training on impaired physiological functions associated with chronic neck pain, a systematic review. So let's fast forward down here to the conclusions. Deep cervical flexor training can successfully address impaired neuromuscular control. Okay, that's one of our other big bullet points here. So neuromuscular control meaning things like proprioception. So having impaired proprioception in the neck is something commonly we see in whiplash. It'd be common in any person in the subgroup of the neck pain classification system, movement coordination dysfunction, and also people with cervicogenic headache and dizziness. You often see, if you do a joint position error test, that it will be abnormal in these individuals. Well, apparently, if you train the deep neck flexors, get those stronger, functioning better, those measures of neuromuscular coordination, like joint position error, those improve. So yes, if you train the deep neck flexors, you will get improved neuromuscular coordination, but not necessarily cervical flexor strength and endurance at higher contraction intensities. And I think that makes sense. If you look at the traditional exercises that people are doing, they're not so much high intensity exercises. This first exercise right here is based off of a test that I don't ever use clinically. I don't find it that useful. Basically, you have this weird specialized blood pressure cuff type of thing. It has a specific name that I'm blanking on at the moment. But you basically put it under the person's neck, flanking their occiput. And they lay on it, and it has a certain amount of pressure at baseline. And they can see that pressure here on the gauge. And what they're supposed to do with control is at the start pressure, go up maybe 2 units of pressure, and then come back down with control and do that a certain number of times. And then they go up 4 units of pressure and then come back down. And then go up 6 and just basically repeat that process. And so, yes, that makes sense that that would improve neuromuscular control. Does that make sense that it's not going to substantially improve strength or endurance? Yes. That's not a strengthening exercise. That's more of a proprioceptive motor control type of exercise. If you look at this one, another common one that's given, this is just, again, based off of the deep neck flexor endurance test. The person engages a chin tuck and then raises their occiput about 1 to 2 inches off of the table and just holds for approximately 30 seconds. I think for men it's a little bit higher for standard value. For women it's a little bit lower, but approximately 30 seconds. Now, again, this one will likely give you improvements in endurance, but again, maybe a little bit of improvements in strength, but those strength gains are going to plateau because there's only so much weight that your head can provide. So if you want to get those improvements in strength and even more improvements in endurance, we need to be doing much more aggressive exercises, and we will see those in just a minute in this video. So, neck training, specifically of the deep neck flexors, is not going to improve strength in the gross neck musculature, like flexion, extension, rotation, and side bending. If I want to strengthen rotation, I need to specifically do rotation against resistance, right? I'm not going to just train cervical retraction and magically my rotation is going to get stronger. It doesn't work like that. And even within cervical retraction, just doing these exercises, you're going to plateau in strength because there's only so much that you can glean from those exercises. We need to be going more aggressive if we want to get more strength gains out of that muscle group. And they go on to then say, a multimodal training regime is proposed when the aim is to specifically address various impaired physiological functions associated with neck pain. To translate, neck training exercises should be specific to the specific impairments. So, in other words, if your neck extension is weak, you need to be training neck extension. If rotation is weak, you need to be training rotation. If your deep neck flexor endurance test is positive, not able to hold the head up, or there's significant SCM compensations or other compensations, then you need to be training the deep neck flexor muscle group. And don't forget that just because you have a normal test here, just because that you're able to hold your head up, there's no compensations, not really any shaking, nothing abnormal with the test, doesn't mean that you can't further get your deep neck flexor stronger. And that may be something that's important if you're going back to sport, particularly a contact sport. So don't base the entire plan of care off of just the result of that test. So we're going to get to the exercises right now. One of the simpler ways to strengthen the deep neck flexor muscle group without any need for any equipment is really just doing it in the same position that you would perform the deep neck flexor endurance test in. So basically in supine, laying on your back, and you can't see it here, but my knees are bent to about 90 degrees with my feet flat on the table. Now, when you're doing this movement, you are engaging a chin tuck or cervical retraction and lifting the back of your head a little bit, approximately 1 to 2 inches off the surface of the table. Now, if you have a lot of meat on your upper back, or you have a little bit of extra thoracic kyphosis, your head position is going to be a little bit higher than someone who doesn't have that extra back meat or excessive thoracic kyphosis. So just understand that your position may look a little bit different than somebody else, okay? The basic movement looks like this. So you're going to tuck the chin and lift the back of the head off the table. That's what the movement looks like. And with this particular exercise, the goal is to hold that position for a certain amount of time. So it's less of a strengthening exercise and more working on the endurance of these muscles. Now, one thing I like to do when I'm doing this for exercise is use a couple of fingers right on the tip of the mandible and go a little bit under that. What this is for is when I get into this position to hold it, I can feel for any loss of that chin tuck. If I'm not having any visual feedback or I don't have any tactile feedback, I don't know if I'm actually losing that chin tuck. So this can actually be a good way to monitor that. So right on the tip of the mandible and a little bit under, go ahead and engage those muscles and get into the position. And let's say an initial goal is to hold this for 10 seconds. So these fingers provide me with that tactile feedback when I don't have somebody else that's observing, looking for the loss of the chin tuck, and fatigue in these muscles. Now, there's two big things I don't really like so much about this particular exercise that will be addressed in some of the later ones. Number one, as I mentioned before, it really works more on the endurance of these muscles, and you don't really get so much of a strengthening effect. Yes, you could put a weight on your forehead, right here, while you're in this position. But again, it's mostly an endurance-based exercise. If you really want to load up this muscle group, the best way to do that is in sitting, which we'll do in the next exercise. The second thing I don't like about this particular form of the exercise is that it's not as functional. The vast majority of the time when we need the deep neck flexors to be functioning very strongly is in an upright position when we're sitting, standing, in a squat, something like that. So this does not address that. It also doesn't really do much for strength. It does more for endurance. That being said, endurance may be something that you need to work on. Maybe you're trying to improve on the deep neck flexor endurance test. But again, there are better ways to do all these things with some of the exercises we're going to see in just a second. Now, hands down, my favorite way to strengthen the deep neck flexor muscle group is doing it with a resistance band and doing it in an upright position. You could do this in standing, but I find when you're first beginning this movement, sitting is much better because it avoids compensations, particularly in the low back. Because as I do this movement, one compensation is lumbar extension. And when we do it in sitting, it tends to minimize that more than if you were to do this exercise in standing. But understand you could do it in any upright position. Okay, so what we're going to need is some kind of a resistance band. I've got a monster band right here. We're going to place the monster band right on the back of the skull. So basically in line with the top of each ear. Now, before we do this and get too far into it, if the band itself, whether it's a TheraBand, a monster band, bothers the back of your head or your hair if you have any, you can take the band and wrap a washcloth or a hand towel around it, and then the hand towel or washcloth part goes on the back of the head, tends to be less bothersome, and then you of course have your hands on the elastic part, and then you can do this exercise, okay? So to perform this exercise, you're gonna take the band in both hands, put it around the back side of the head in contact with the back of the skull. And then before you ever pull on either end of the band here, you're going to engage the cervical retractors. So here we go. Once I've engaged the cervical retractors, I'm going to hold that and then pull the band outward like that and hold for a predetermined amount of time. Usually I'll have people begin with 5 seconds and then work upwards to approximately 10 seconds. But again, we're working more on strengthening here, so we're not really so much concerned with doing a 30-second hold like we would do in the supine version as we would do in the deep neck flexor endurance test. So we're going to do multiple reps of anywhere between 5 and 10 seconds. So here we go. Engage cervical retraction and pull on the bands and hold. And let off. And I would repeat that as many times as I wanted to. Now, the benefit of this form of the exercise is it's much easier to load up more resistance than it is in the supine version. And like I mentioned before, sitting upright or standing is a lot more functional than the supine position. So when you're doing this, you would of course begin active range of motion just to make sure that was okay and pain-free. But again, once that is pain-free and you're able to do that pretty well, then you can get a lighter elastic band, usually those TheraBands that most clinics have and they give away to patients. Once the TheraBands or regular elastic bands are too easy, then you can progress to something like these monster bands, as you just saw. Now, using the monster bands to strengthen your deep neck flexors or cervical retractors is a great choice of an exercise. However, as your deep neck flexors get stronger, there may come a point where the monster bands, no matter how much you use, you're not really gleaning a whole lot of strength gains from that exercise. There's some diminishing returns that may occur. And so if that happens, and you find that you're not getting any more gains out of the monster bands, you can progress to a closed chain version of this exercise. Now, we're going to do this in the quadruped position. So basically, you're starting on your hands and knees. Now notice, when I'm on my hands and knees, my forehead pretty much exactly lines up with this pad on the Bulgarian split squat stand. Now, not everyone has access to one of these, but what you can certainly use is the edge of a stool or a chair or a table if it's low enough, and just put a cushion or something on there like that, so that way you're not having your bony forehead directly on a hard surface. But let's see what this exercise looks like, okay, regardless of whatever surface you are using. So I'm in the quadruped position, and what I'm going to do is I'm going to start here each repetition in a little bit of cervical extension, and I'm going to draw my chin towards my sternum or toward my chest, and essentially pulling my neck into that cervical retraction. And once I have that, I'm just going to hold. So let's see that. Hold. And when I'm there, I'm trying not to put a huge amount of weight through my hands. Yes, I'm weight bearing through them a little bit, but I'm trying to distribute my force so it's as much through my head onto this and less through my hands onto the floor or onto the bottom of the stand here, because my goal is to strengthen these deep neck flexors. Now, the obvious way you can progress this is by taking one hand away once you're in that position. I generally always start with two hands and then take one or both away. So let's see that. Like that. And as you might guess, the last progression before we start taking one foot all the way back is to just take both hands away altogether. Let's see that. Very, very challenging on those muscles. And again, you would probably do this with about the same dosage as you would with the bands. So holding anywhere between 5 and 10 seconds. And I usually have people do anywhere between 10 and 15 repetitions of this exercise. Now, before we conclude this video, I want to make sure to revisit the second exercise that we looked at, which was banded cervical retraction. We're going to expand on that in just a minute, but just as a quick reminder, remember we have some kind of an elastic band or a monster band, whatever it might be. Put it around the back of the head, hold each end in one hand, and then engage the cervical retractors and then pull on these to add resistance. Looks like this. Pretty standard cervical retraction exercise. But what's important to understand here is that not every force is going to be directed in this direction. So when it comes to daily life or sports, especially contact sports, these forces may be coming at different angles. Maybe from an oblique angle, maybe from the side. And we want to make sure that we're training these muscles to keep the neck stable and safe with forces from a variety of directions. And so for this one, we're going to be using a lighter band, not that heavier one that we used in that demonstration. Okay, so a little bit of a lighter monster band here. Same positioning of the band, except now I'm going to pull it out at a 45-degree angle. So not directly out in front, not directly out to my right side, 45 degrees between those. And I'm going to keep my neck in the same position, engage the cervical retractors, and pull on these. Obviously, I can take this and pull the opposite direction, 45 degrees that way, same idea. On any of these types of exercises, the major goal is to see no net movement of the head once you get into that cervical retraction position. Obviously, you can do the same thing pulling directly out to the side. So directly out to my right. Same thing, engage cervical retraction. And come back. Another thing that you're also able to do is do this dynamically. So not just a static angle. So what that might look like is this. Again, no matter what angle or angles you're doing this at, the goal is to keep your head exactly in the same position the entire time. And again, that's a really good neuromuscular exercise to start training neck stability with a varying force or a direction of the force. So hopefully this video gave you a good understanding of, number one, why we would want to strengthen the deep neck flexors, and two, how we go about doing it with appropriate progressions. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.